Women continue to spend significantly more time on unpaid care and domestic work, including childcare, cooking, water and firewood collection. This imbalance is not only a gender equality issue. It is also an economic issue. This is why, as UN Women, we say care economy must increasingly be understood as an investment case.
This dialogue offers a timely opportunity, not only to reflect on progress made, but also to confront persistent gaps to concrete, inclusive, and transformative outcome for our country, Rwanda.
Care work, both paid and unpaid, supports all other sectors, providing the foundation on which societies and economies function. Despite its critical importance, care work has historically been undervalued and under-recognized, with women and girls bearing the disproportionate burden.
Umugabo none haraza akabona ko ndi uw'agaciro kubera ko yazaga agasanga nsa nabi, nta mwanya wo gukaraba, bitoro nabyutse ntunganya umwana muto afite imyaka 6, namara kumutunganya nkateka igikoma bikamvuna nkajya guhinga nyerewe, ariko ubu ngubu haraza agasanga nsa neza nakarabye, nanjye mpagarara mu bandi nkumva ndi uw'agaciro, mfite ijambo kubera UN Women.
Last year we launched a product called Shabuka to finance women-owned and women-led companies. The uptake is there. Our observation from that product is that many women are still working in informal sectors. The lessons we got from there is that we need to mobilize affordable funds and be able to give to microfinance and financial institutions to be able to lend to those women, because there are very many and they have the willing to grow the economy.
I'm with UNICEF, and for us, the early childhood development is very important. It synergizes, because if you catch kids early stimulation will help them learning, but it's also a platform for nutrition.
We are so advanced in terms of gender responsive planning. How about the expenditure? How do we make sure that actually we are spending in a gender responsive and transformative way?
Calling on the stakeholders to see that we crowd in funding to see how to support our ECDs. We still have a challenge, especially with home-based ECDs, still a long way to go. So that's why we call in our stakeholders to bring in financing into ECDs, so we can harmonize with the intervention and the financing so it can be channeled in one stream.
What we have done so far with the Ministry of Gender, we came up with the National Men Engage policy. It is there, it was adopted by the government, and this policy backs our activities because it shows all areas where men can work and can improve so that they can support the work in gender equality.
I think all of us, we know the new family law has been an entry point for the government to recognize the unpaid care work. It is the beginning, a legal recognition in policy but also in laws of the unpaid care work. Now, when the spouses are divorcing, when the judge is distributing the assets, he has to look for the value of the unpaid care work between 10 and 39%. That has to be valued and given to the spouse who has been doing the unpaid care work, and most of the time the women.
If we are valuing unpaid care work, how can it be included in our GDP calculations? Is it possible? And it's possible because it's been done in other countries. We can borrow, we can benchmark. So we could actually advocate for that, and this would actually reduce a number of issues that we are discussing in the room.
Most of the times we set the policies and then there is the implementation plan, but communication is still a key challenge to implementation of these policies. But what about the youth? What about the women? What about those families who cannot be in the Mogoro Wababye in the Muganda, but they are always scrolling on their phones? So it's very important for us to analyze how do we communicate these policies, because along the way it will be lost in the process.
If we can have a collaboration that can develop modules or programs and integrate them into the Ndumya Rwanda program and Itorero or civic engagement programs that can support advancement of care systems into schools, universities, that can support early mindset change, mainly in youth.
You could see that there is a lot that has been done, but also there is still some gaps to be addressed. And I think this project is not ending in terms of its mandate, in terms of interventions. Rather, how do we really do more of such interventions that are very transformative?
This dialogue is one of the most important steps in shifting our collective focus from recognition to real action, from commitments to implementation.